The hidden crisis in healthcare. The sterile smell of the hospital still clung to Maria's clothes hours after she left. Her mother, barely 60, lay in a bed, a victim not of a rare disease, but of a system stretched thin. A persistent cough dismissed as a lingering cold for weeks. A diagnosis delayed by an overwhelmed GP. A specialist appointment months away. By the time the truth of advanced lung cancer emerged, it was a whisper of hope against a shout of despair. Maria wasn't alone in this silent suffering. Across the globe, countless families face similar battles, their loved ones caught in the gears of a healthcare machine grinding under immense pressure. Long waits, missed, and avoidable deaths are not footnotes in medical textbooks, but tragic headlines in the lives of ordinary people. AI isn't here to wield the scalpel or deliver the diagnosis on its own. Its power lies in its unparalleled ability to process vast, disparate datasets, to see patterns invisible to the human eye, to untangle the knotted threads of information that choke our healthcare systems. Consider sepsis, a silent killer, often mistaken for other conditions until it's too late. AI-powered voice recognition and natural language processing can now auto-write clinical notes, transcribing conversations, summarizing key findings, and populating electronic health records with astonishing accuracy. It's not just it reduces errors and ensures a complete, accurate record of care. AI algorithms, trained on millions of patient records, can now predict the onset of sepsis hours, even days, before human clinicians, flagging subtle changes in vital signs that would otherwise go unnoticed. We worry about losing control, about algorithms making life and death decisions without human oversight. AI is only dangerous if we ignore it, if we develop it without ethical guidelines, if we abdicate our responsibility to control its implementation. It is not dangerous if we embrace it as a partner, if we design it with human oversight at its core, and if we ensure its development is guided by compassion and a commitment to equitable care. Data privacy is a legitimate concern. Who has access to our most sensitive medical information? The specter of bias, where AI might inadvertently perpetuate existing inequities, looms large. And perhaps the most visceral fear of all, machines replacing humans, rendering skilled professionals obsolete. This early warning system has given doctors the precious time needed to intervene, saving countless lives. AI is a tool, an incredibly powerful one, designed to empower doctors, nurses, and administrators, freeing them to focus on what truly matters. The patient. We have everything, and yet we're failing, and an AI instantly analyzes their symptoms against their medical history, suggesting potential diagnoses and highlighting critical alerts for the doctor. Picture nurses freed from endless charting, spending more time comforting patients and educating families. It's here to liberate doctors from the mundane, to empower patients with knowledge, and to offer families peace of mind. It's a tool that can amplify our compassion, extend our reach, and ultimately save millions of lives. Envision families receiving real-time updates on their loved ones' conditions, feeling connected and informed, even when miles away. This isn't science fiction. This is the promise of AI in healthcare. A simpler system, where complexity is managed by machines, allowing humans to focus on the inherently human aspects of care. A safer system, where early detection and proactive interventions become the norm. A smarter system, continuously learning and adapting to provide the best possible outcomes. It's a paradox that haunts us. We boast brilliant doctors, their minds repositories of decades of knowledge. Our hospitals are equipped with advanced scanners and surgical robots, marvels of modern engineering. Our pharmacies stock powerful drugs, breakthroughs against diseases once thought incurable. Yet, despite this formidable arsenal, healthcare outcomes often disappoint. AI systems are being developed to monitor patient progress, cross-reference treatment plans with outcomes, and, in critical situations, even alert designated family members if certain care protocols are not met, or if a patient's condition deteriorates unexpectedly. It's a layer of intelligent oversight, a digital guardian angel for those who need it most. Patients still fall through the cracks, preventable conditions escalate, and the emotional and financial toll on families remains crushing. Why? The enemy isn't a lack of resources or expertise, it's complexity. What's killing the system isn't disease, it's complexity. Imagine a sprawling, intricate city where every street is perpetually jammed, every intersection a tangle of conflicting signals. That's modern healthcare. Bureaucracy stifles innovation, a labyrinth of paperwork consuming precious hours. Overspecialization creates silos, making holistic patient care a fragmented relay race between departments. And the staff, The very heart of the system are relentlessly overloaded. The compassion strained by endless shifts in administrative burdens. The system is so advanced, it can no longer manage itself. It's a victim of its own intricate design, a leviathan struggling under the weight of its own operational demands. AI enters the scene. Into this chaos steps artificial intelligence, not as a replacement for the human touch, but as a much-needed conductor for the medical orchestra. From diagnosis to survival, real-life AI successes, the stories are already emerging. Quiet revolutions happening in hospitals worldwide. Or, think about the relentless burden of clinical notes. Doctors spend hours each day dictating or typing, time that could be spent at the patient's bedside. And then there's the heartbreaking reality of hospital failures, where communication breaks down and families are left in the dark. Why AI still scares people. Despite these incredible advancements, a deep-seated fear of AI. These fears are not unfounded, but they often misinterpret the true nature of AI in healthcare. The future, a simpler, safer, smarter healthcare. Imagine a future where a patient arrives at the emergency room. Final reflection, plus CTAAI, is not here to take away the human part of medicine. It is here to give it back. Would you trust an AI to help take care of you or someone you love? Comment below.